Coming now to Dr. Ambrish Mithal, I think perhaps if it is any indication on what is an area of maximum concern as far as comorbidity is concerned, based on the number of questions we got before the webinar, it's probably around diabetes, around sugar, around black fungus. A lot of people have been complaining about sugar going up post COVID. A lot of people have been, of course, complaining about, you have to take steroids as one of the most important treatments for COVID. That in turn leads to fungal infection, black fungus. That in turn could lead to, antifungal treatment could really lead to kidney failure as well. So a lot of these comorbidities are linked. So what should a patient do when he's got these symptoms? We've got questions where people are saying that, even months after recovering from COVID, they still have fluctuations in their sugar level. They never had diabetes before. What should a pre-diabetic patient do? What should a diabetic patient do? When should they? When and how often should they get tests done? And what are the other related issues? Over to you, Dr. Mithal, please.
Thank you very much, Ashwajit. So it's a pleasure to be here. And to give a background, we have to look at it in like two sort of separate areas. And that is, they're interlinked, but at the same time, they're separate. What is the impact of COVID on people with diabetes? And what is the impact of diabetes on COVID progression and outcomes? Right? So it's a loop. What does COVID do? So supposing let's talk of the latter first. Supposing, someone has diabetes, pre-existing diabetes. Their chances of contracting the COVID infection, corona infection, are not significantly higher. It hasn't been shown that. So that's number one. People think I've got diabetes, I'm going to get hit by COVID for sure. Not true, right? But if they do get COVID, then their chances of poorer outcomes are higher as compared to someone who does not have diabetes. That we all understand. At the outset, we need to know, what does this mean? This means that if you have diabetes, then your chances of getting hospitalized are higher. If you are hospitalized, then your chances of getting into the ICU are higher, and subsequently whatever. So there is a risk of adverse outcomes. And in our own data, which we published in December, of 401 consecutive patients who were hospitalized last year in August, September, we found that diabetes was a significant predictor of adverse outcomes, right? So, and even the admission HbA1c, which is a 3-month average of your preceding 3 months, so blood glucose average of the preceding 3 months, that correlated with outcomes. So it did seem that diabetes had an impact on outcomes. But again, as we very rightly pointed out, you don't put all diabetes in one basket. So there are people who have relatively recent onset diabetes, or even if it's long duration diabetes, there are people who have well-controlled diabetes without other comorbidities. And such people actually are almost as good as someone who doesn't have diabetes. So the ones at risk that we found even in our study were the ones who had multiple comorbidities. Okay, so for example, if diabetes is poorly controlled, of course, age is an important factor in determining outcomes. But if poorly controlled diabetes exists, diabetes with vascular complications exists, like, of course, as already discussed, kidney, liver, heart, it has a huge impact on outcomes. Uncontrolled with comorbidities, even diabetes and hypertension together make a much more potent mix for poor outcomes than just diabetes. So it's not just the blood glucose that's doing it. If you control your blood glucose well and keep your other parameters in control, like blood pressure, etc., simply by connecting with your physicians regularly, which is now possible in most cases by telemedicine and the use of remote consulting. In our field, in endocrinology and diabetes, it actually lends itself very well to remote consulting also. So if you can keep your parameters within a range, then your risks can be substantially reduced, even if you get hit by COVID. So this is the connection that we have. What happens if a person with diabetes gets COVID? What happens if the other thing that happens is that the sugars worsen? There is no question about that. what COVID does to diabetes. It worsens the sugars, and A, any infection worsens the sugars. B, any serious infection, a severe infection definitely has a greater impact on sugars, and stress, hyperglycemia, not just an infection, but in Dr. Trehan's patients in the wards, we have seen in Avi's patients who are otherwise healthy, when they are very stressed in their physically stressed by their medical condition, their sugars tend to go up, right? So you have that. So one is just any infection, then the stress of any disease, acute disease. And thirdly, it is possible that the virus itself may be playing mischief there. Like other parts of the body, there have been studies now showing that the pancreas may be directly hit. Last week, a study again came out showing an autopsy study showing that the pancreas of people was impacted by the virus. Pancreas is involved in insulin secretion. And the last point on that is that steroids are the most commonly used agent, which are actually, if used correctly, are life-saving for our patients in COVID, during COVID. And steroids have a huge impact on diabetes, on blood glucose. So even people who have not had diabetes, who are either in the pre-diabetic zone or not even in that zone, sometimes can get high blood glucose when they are given these high doses of steroids, especially when they are hospitalized. And one of the big challenges this year was that many of these patients could not get hospital beds. So through remote consulting, patients on high doses of steroids, home oxygen, we were managing people with blood sugars of 300, 400, teaching them insulin, how to monitor, but it worked. Let me tell you that if you get proper advice and if you follow it, even with severe hyperglycemia, we call it, very high blood sugars related to COVID and steroid, it is possible to get a good outcome. So, of course, we all know that this virus sometimes behaves in a very funny is not the correct word, in a very strange way. And sometimes it belies all predictors, and it just does its own thing. But by and large, you can reduce your risk very substantially if you follow that. So remember, one important point before I hand the mic back to you is that the prevalence of diabetes in India is very high. And we are actually looking at what we call a syndemic. A syndemic is when two epidemics converge, like when two things converge. So we already have an underlying sort of epidemic of diabetes. You know that in Delhi NCR, where we are talking right now, the prevalence of diabetes at the age of 40 would be above 20%, 20-25%. And at the age of 60, it would be like 35-40% of people are already diabetic. So imagine in this fertile field for the COVID to grow, you sprinkle this, throw this COVID virus all around. On the other hand, if there was a population which had a diabetes prevalence of 2%, like India had maybe 50 years ago, okay, then the impact of COVID via the diabetes mechanism would be much, much less. So this is actually a wake-up call for us that unless we deliver chronic care better, whenever in subsequent, God forbid, any epidemics or pandemics, we'll be hit much harder. So therefore, it's important for us to do both things together, not to panic if we have diabetes, but controlling it well, even without COVID, and making sure that we reduce our risk. If you're overall healthier, our risks will be much less from getting impacted by COVID.
Perfect. Thank you so much, Dr. Mithal. I think that's clarified a lot of questions. I'm just going through the questions as well, but I think the opening remarks of all three of you have addressed a number of questions. And now that we've got another 15 odd minutes left, let's just, a lot of questions have been already typed in. If you'd like to pick up any, but I would just maybe pick up a few. I'll read out the questions and then, you depending on who'd like to answer that. There's a question around, the black fungus cases in kids in Mumbai. Somebody's, Ria Sethi said that her son is 9 years old and recovered from COVID. She wanted to ask if he's still open to infection as the reason fungus is not provided. How much of risk is he still at? Then we've got another question that people say that COVID is airborne. I've not been going out. I've been advised not to go out to parks as well. If I don't exercise, then how do I, keep fit? If I don't keep fit, it's a catch-22 situation. I can still have my diabetes gets affected. My heart situation doesn't improve. There are some questions around people who had the first jab of Covishield or Covaxin, and now they're wanting to know whether they can have the second jab of Pfizer if it's available. And of course, I'll take one more question, and then maybe we'll take another lot after that. The question around blood clotting as well. I think that's been addressed. Yes, there is a question around Dr. K.K. Agarwal had both doses since they are part of this, partners in this. So what happened? I mean, because that was a great loss to the entire medical fraternity. And there's a question around somebody's, Rachna's mother, who's 85 years old, recently COVID recovered, negative after 4 weeks, but a bilirubin raised with days, 2.5, 3 days later, 5 another 3. Hepatitis tests are negative, ultrasound is clear. So what is the problem? So maybe we can just open out with these questions and we'll take a second round. If you can, I leave it to you to answer.
So I can answer the Mucor question. So I think the risk of a 9-year-old child getting Mucor is post-COVID is really very, very low, unless the child is an insulin-dependent diabetic. Before COVID hit us, mucormycosis was largely a disease of insulin-dependent diabetic children. In my previous assignment with my colleagues here, we've handled intestinal mucormycosis. We had the team staying there 24/7, reported those cases, cutaneous mucormycosis, all kinds of rare things. But that was once or twice a year. What has happened with this is that the excessive use of steroids, if I may say, some necessary, some excessive, along with less attention to diabetes, especially in centers which are not particularly well equipped for that, has led to proliferation of this normally occurring fungus in our nasal mucosa cavity, and then progressing to the eye and brain and whatever. So in a 7-year-old child who doesn't have diabetes, and if he has recovered from Mucor, it's completely all right. The risk is very low. Of course, if he complains of any specific thing like a nasal discharge from one side or a bloody discharge or pain on one side of the face or eye, one should see an ENT. But I think the risk largely is in people who have diabetes. 80% by and large worldwide, the data suggests, are people who have diabetes. 76 to 80% are those who have received steroids. These are the two proven factors for Mucor. Otherwise, people are speculating lots of factors. But these are the two factors that are very well proven. And if one has taken care of these things, then mucormycosis should not, really scare you. That it's a scary disease if it happens. No question about that. It's not a good disease to have. But nevertheless, if we are not in the high risk zone, we shouldn't keep worrying. And I get so many calls about this. I've got, some little pain. You think I could be having Mucor? So it's still not common. It's far commoner than what it ever was. But in absolute numbers, it's still not common. And for somebody who doesn't have all these things, the risk is very, very low.
Perfect. And what about the airborne? How airborne is the disease? Should they go for walks? Is it safe to travel on flights right now? What about air conditioning? Can they go to office and have the air conditioner on?
So see, everything is relative. You have to weigh your risks with what is involved. So open air walks are absolutely safe. Open air walks with masks, it's not that the virus is floating around in open air. There are very few documented major outbreaks in parks and all, unless people are congregating and taking off their masks to have a meal together. So I actually, for one, have always been advocating, and you may have read some of that why are the parks not open? I mean, you have to get actually people out. In closed indoor environments is where the virus spreads. Open air, and just wear a mask, a proper mask, and you're pretty safe. Don't do it, make it a social activity, as many of us like to do. Go for a walk on your own with your phone or whatever, or iPod, whatever you use. And I think it's the best thing you can do. Don't interact socially with people. So open air walking is not a problem, provided you wear a mask and don't engage in social conversation. Just hi and how are you types, that's all right. Just crossing each other, you will not pick up the virus. So I think that's very, very important messaging. It's much worse to meet family members who've come from outside, guests who think you are there, your own, and unko kaise hoga, wo to तो अपने ही है सब, and have them for a cup of tea in your house, that is far more dangerous than going out for a walk. And of course, people can, as Dr. Trehan will probably, he's an expert in that, can exercise very well at home. I mean, there is no question. If people are, not able to go out for some reason, or don't live in an area where they may not be living in an area where there is enough open space, then definitely they can exercise at home. We all know the benefits of pranayama and yoga and, exercise at home. So there is no question. But exercise is a very, very important tool to build your lungs and protect yourself from COVID or the adverse effects of COVID.
Right. Thank you.
From that point of view, Surya Namaskar is a complete exercise in itself. So yes, in extreme terms, that is something you can fall back on. But as Dr. Mithal said, there's nothing like a walk in the fresh air. But there is no fresh air in Delhi. You're probably exposed to so much pollution on some days that it actually negates going out. But anyway, I would like to talk about the mixing of vaccines. So there is a lot of interest, first of all, not a lot of data yet, but a lot of interest in the fact that can you enhance the immunity of an individual by combining two platforms. Platforms being like, so there is some work done in UK on AstraZeneca and Pfizer and also Moderna. There is a study going on in Brazil right now. There are studies being done. We've started something in India also. So the basic thing is that with mixing of vaccines, there have really not been any major adverse events. So there is some data which says that if you mix the vaccine and like the Pfizer or Moderna that were used as the second dose or even as a booster dose at some point, what you saw was people did get 1 or 2, 3 days worth of fever, headaches, and some shivering. So but that's not a frequent thing, but fair number. So one should be ready for some kind of reaction if you need the booster. Now, the whole controversy revolves around antibodies. Are antibodies in themselves an indicator of your immunity or not? So that's debate will only get settled because if you look at the physiology and the science behind immunity, it says that there is for short term, antibodies may have much more relevance than for the long term, because long term resistance or immunity is stored in T cells and B cells. So that's what we call memory T cells. So cellular memory is probably more effective, like we see in many other forms of immunization. And that is something that unless enough data comes out, which is in progress right now, you wouldn't know 100%. But the ones that we know who have gone and mixed their vaccine after the first dose have done perfectly okay. We don't have enough people who we know, but there are studies going on. There's a large study being done right now that after 2 doses, is it a good idea or not? We don't know. So there is a lot of concern in people whose antibodies are not either at the body are not developing or vanishing real fast. They are the ones who sometimes get anxiety. But the worldview is that you should not depend on antibodies counts, and most of the world is not doing that. But in India, it has become a little more of a talking point to say what is your antibody count, and more so in people who are in the social circuit. So there is still confusion, but the data will tell as we go forward. Now that also, I am like on the Supreme Court committee, that National Task Force for dealing with the current problems of COVID, infrastructure, supplies, and preparing for the third wave. So there's a lot of work going on in our committees, and the blueprints are being written. So oxygen, you can say, was the first terms of reference that the court gave us. We've done a lot of work on that, and I think we'll be prepared for any eventuality, even if it goes above the last wave. So there has been a lot of groundwork done by way of reserves, by way of variety of sources for oxygen, including with the oxygen generators, concentrators, all that other stuff. I think we can deal with it much better. But then, as you saw, the critical pharmaceutical supplies, like nobody anticipated that we would get the mucormycosis, better known as black fungus, in such quantities that we will not have enough amphotericin. I mean, so it's been one nightmare after the other. Of course, we'll block all these things. But the main thing is to say, okay, COVID-appropriate behavior, repeat that thousands of times. All of us should do it. We should practice it, and we should say it, because that is our main weapon. But at the same time, we have listed the entire need for children. God forbid that wave comes. So that is already in progress right now. We are about to submit it as a report of the National Task Force to the courts very soon. But I think one thing I can say here, that I've found from the inner sanctums, that the government is working very hard on trying to tackle these problems. So it's like, as it may appear, which it does because of the sheer size of our population that we are wanting, but I'm not sure any country could have dealt with this kind of situation that we had. As 4 lakhs a day is a mind-boggling figure. United States was buckling under 250,000 cases a day. So the fact that we survived, there's a lot of misery. Yes, many people were in very bad shape on the streets. But otherwise, overall, I think we have coped with it well. But today, if we do not keep up our guard, it is not going to help us in the future. So I think you stress it again and again, that the virus is still around. It's not gone away. It is mutating inside everybody that gets infected. And God knows how many thousands there are. There are more than 2,000 documented. So surveillance, early warning systems, preparedness, public awareness, and immediate reaction of tracing and locking down. I think those are the kind of things we can do to not to suffer this fate again. Thank you.
I think very useful.
Avi, you got a few questions on fatty liver as well. What precautions are you going to
Sure. So I'll quickly take 2 or 3 directions in which the questions have come. One is the fatty liver and liver enzymes and bilirubin. Somebody's bilirubin has gone up from 2 to 3 to 5 to 7. So like I said in my earlier remarks, if someone's bilirubin has gone up or enzymes have gone up, either they're going to be temporary and they're going to come back down in 3 to 4 weeks, or it is quite likely that they have a pre-existing fatty liver. That fatty liver could be alcohol-related or diabetes-related or non-alcoholic fatty liver. And they probably missed it because it didn't cause any symptoms before. But now that COVID happened, their enzymes have gone up and they are worried. So I think that is what's happening. They need to see a liver expert immediately. And like I said, majority of these instances, they would settle down with conservative treatment. It's not going to result in anything nasty. The other things are, of course, you have to control diabetes and lipids, and alcohol has to be avoided, etc. If you're overweight, you have to, bring your weight down. So the same things which I said earlier could be the reason that, unexpectedly the liver enzymes have gone up, but they would get better if you control the precipitating factors. The other line of questioning, which I'll just address, is some people have asked, what if I've had 1 bout of COVID and 1 dose of the vaccine? Should I go for the second dose or not? And there are some other people who want to know if they have to repeat the exercise next year. Well, the second question is a bit easier, but it is a little more fuzzy at this point. It is likely that we will need revaccination year after year or maybe every 2 years.
There is a study recently that came out about a week ago that shows that there is a protection of the infection and vaccine doses, both to the tune of 8 to 12 months. So yes, it will protect you for about 12 months at least. Since we haven't had that much time beyond 12 months after vaccination, in fact, we haven't had more than 6 months at this point. So we don't really know the answer to beyond 1 year, but it is likely from the lab studies and people's experiences with infection that protection will last a year and you may need another vaccine next year. Now, as to the question of infection plus 1 dose, is it good enough? Again, there are some data from the UK which show that there may be a good protection of 1 Pfizer dose in addition to the previous infection that somebody may have had. We have our own data from Vedanta, which Dr. Trehan knows about, where we found that people who already have antibodies or a history of COVID infection, after 1 dose, they had better levels of antibodies compared to someone who didn't have COVID before and had 2 doses. So we have this data and we are writing it up as a paper, and hopefully it will be published soon. So there is some evidence that 1 infection plus 1 dose of vaccine may be good enough, but this is not incontrovertible at present. So at present, 2 doses of vaccines is what you need. And if you've had an infection bout, then wait 90 days before you go for your vaccine. In fact, if you have any procedure scheduled, you should take it. You should take the vaccine 4 weeks after the procedure or 2 weeks before the procedure.
Perfect. I think that's very, very informative. I know there are lots of questions. There are at least another 50 questions, but I know we're running out of time. So with your permission, if I could just compile, we would get these questions compiled and maybe send them to you if you can, because I'm not sure whether you have more time given the fact that all of you are very busy doctors. So with your permission, yes, Amrish, Hanji.
I think just one point which deserves reiteration is that diabetes is not a contraindication to vaccination. There's still so many questions on that in the chat box. If you have diabetes, it's all the more reason to get vaccinated and vaccinated fast. That's very important. Don't need any special tests. Don't need anything. You should, of course, control your diabetes. But even if you're uncontrolled, don't wait for it to be controlled. You just get your vaccine regardless of what kind of diabetes you have. But that's very important. Still, people are, every day I get these calls, my sugar is high. Can I get a vaccine? Today, this morning, it's 200. Can I go for my vaccination? Yes, you can. Please get your vaccine regardless of your diabetic status.
Perfect. So with your permission, can we extend for another 5-10 minutes, or should we send you the questions, or would you like to give? I mean, maybe you give some closing remarks. The questions are in front of you, so I'm aware that all of you are very, very busy doctors. So if you'd like to give any closing remarks in addition to what you've just said.
I've done mine.
Perfect.
It was a pleasure. Like I said, it was very, it was very, very engaging, the interaction, and I hope people who participated have benefited.
So we'll maybe send you some of these
questions. Happy to address the questions. Yeah, sure.
Yeah, we'll try and send you the unanswered questions if you can, address those. And it's really reassuring, I think, for all of us to know that so much research has been done by all of you individually as well as collectively within the institutions you're with. And hopefully, as and when there is a third wave, we are in safe hands. We will be far better prepared for the third wave, and hopefully, we will not have the same kind of, panic as well as fatality that we had in the last wave. Thank you so much. With that, I'm handing over to Dr. Harsh Mahajan to give the formal vote of thanks. Thank you all for being here.
Thank you very much, Ashwajit. It was really a very engaging, very informative session, and done in without using any of the medical jargon that most of the big doctors are used to. So thank you very much, Dr. Trehan, Dr. Arvinder Soin, Dr. Ambrish Mithal. These are really the stalwarts of the healthcare field in the country. And we are so fortunate, lucky, and honored to have them on the Meradoc platform. And as you can see, we hit the peak as far as the number of people who could join was. And in addition to that, we have so many other social media platforms where this is being shown live. So thank you all very much, and we hope that a few weeks down the line we may get you all back again, because this has been a very dynamic learning process during this pandemic, and every 2 weeks we learn something new and have to course correct. I would be failing in my duty if I did not thank the London School of Economics Alumni Association of Delhi, who've been very active. Masosa, the Modern School Old Students Association, IPA Global, and Ashwajit, and of course, the Heart Care Foundation of India, Dr. K.K. Agarwal Research Fund. Dr. K.K. Agarwal, who is so dear to all of us, a very, very close friend of mine, and who gave his all during this pandemic in educating masses at large. In fact, there used to be 100,000 people listening to his webinars and his talks, and we really miss him dearly. But I do know that wherever he is, he would be again healing and teaching and training in that world as well. So thank you all very much, and we look forward, Ashwajit, to the next webinar. Thank you, Miradoc.
Thank you so much. Thank you once again. Thanks a lot.
All the best.
Okay.
Thank you.
Thank you, sir.
Thanks, Ashwajit and Harsh.
Thank you, sir.
Thank you so much. Thank you so much.
Bye-bye.
Thank you.